Hello, everybody. We are back here on Healthcare Experience Matters, and I am joined today by Healthcare Experience Foundation President and co-founder Katie Owens. We are both really excited to tell you about our highly anticipated fourth cohort of the Certificate in Foundations of Compassionate Leadership. It's a 2-day virtual event. So, Katie, I've asked you to join me today to talk a little bit about self-compassion and preview the event a bit. So let's start out by me asking you, what is self-compassion?
I'm happy to share about self-compassion. It's one of the most frequently cited takeaways among the participants of our certificate program. Self-compassion it's a practice and a habit of treating ourselves as individuals with kindness, care, understanding during difficult times when we're experiencing a sense of a personal shortcoming or disappointment. And really, in its most simplest form, it's extending the same kindness and compassion and empathy towards ourselves that we would offer to a friend who might be struggling or experiencing that same disappointment.
Okay, Katie, thanks for explaining self-compassion. Now let's get into why it's so hard.
Gosh, I think my question would be to those listening today, what gets in the way of self-compassion? Our work as leaders, as individuals, as healthcare team members can be both extraordinarily rewarding and it can also be stressful, challenging, and emotionally demanding. We encounter on a day-to-day, moment-to-moment basis high pressure situations, long hours, and the constant need to care for others while we're caring for ourselves. And many of us struggle to extend that same kindness to ourselves that we would to our friends. And so we've got to really double down on self-kindness, even when it feels like we're most challenging to do so, because self-criticism is ingrained and it's very natural. Barbara Fredrickson, who is a well-known positive psychologist, says the positive is going to slip off like Teflon, but the negativity is going to stick. And so many of us, myself included, can have a high degree of commitment to perfection and fear of failure. And it's ingrained in our societal messages to be the leader, to be the best that we can be. And at the end of the day, we are human beings taking care of other human beings. And so we lack a sense of practice. And so one of the things I love the most about our program, and I think this is why we have so many ahas from participants, is we give really tangible daily habits that we can begin to practice and lead forward with ourselves and start to give permission to our team members to live forward and enculturate self-compassion in our day-to-day lives at work and at home.
Absolutely. And we know the last cohort of the Certificate in Foundations of Compassionate Leadership was a major success. We had over 100 professionals from 21 healthcare organizations coming together, deepening their understanding and practice of compassion, things that are beneficial to both their personal and professional lives. I was curious if you had any other feedback from participants.
One of the things that we regularly keep pulse on is the feedback from our graduates and hearing threads, not just from our most recent cohort, but we're now on our fourth. And so when we rewind the tape to our earliest graduates, we continue to hear individuals saying that they have maintained a sense of presence, being mindful to work with their coworkers to foster a positive environment, that they feel more equipped to be accountable and create accountability while maintaining compassion, that we walk with compassion, not just in our mission statements to our patients, but also in our interpersonal interactions. They cite higher degrees of civility and restoration of more professional interactions. And so it's incredibly rewarding to hear in the moment the feedback and longitudinally looking back and how our graduates are continuing to lead forward with the four pillars of compassionate leadership, which is understanding the science of compassion, adopting self-compassion practices, leading interpersonally with compassion, and building and broadening compassion in the workplace. And so to continue to hear those success stories is rewarding, and we can't wait for our new program enrollees to have that same access to these new insights.
Yeah, and looking forward to this fourth cohort of the Certificate in Foundations of Compassionate Leadership event taking place May 11th and 12th. I want to just get your feedback on if there's any programming you want to preview, any keynote speakers you want to talk about. What can potential participants look forward to hearing about?
One thing I'm extraordinarily excited about is for this fourth cohort, we will be welcoming as our keynote speaker, Dr. David Pearlstein, who is the president and CEO of St. Barnabas Health System in the Bronx, New York. He is going to open with a really personal and impactful journey of leading with compassion, creating a climate of compassion in an organization that candidly is in one of the fifth poorest zip codes of the United States. And he has lived this journey for many years, and I think will give participants really a high degree of energy and excitement and some very tangible takeaways to begin to apply immediately.
Yeah, and I will put links to all of this information in the description of today's podcast. So wherever you do listen to this podcast, please just take a look in the description and you'll see more information on where to learn more or where to go ahead and register. So, Katie, did you have anything else you wanted to mention about the event before we wrap it up here?
I just can't wait to see everyone there, to hear the stories, and just encourage you, if you have any questions about the program, reach out to Casey, myself, or any member of our team. We want to do everything possible to support an amazing experience and to continue what's becoming an important body of work.
Absolutely. And I'll just remind you again, check out the description of today's episode to learn more. Thanks again, Katie, for your time. And I really look forward to this event as well.
Thanks, Casey.